provide evidence of how we've used learning from an established high-performing rehabilitation system in the UK to build resilience in Ukraine while it's still at war. The individual level, but exceptionally, we might also add how resilience can be built at the societal level. At the organisational level, I offer my experience of how resilience of the NATO alliance has been enhanced through identifying collective medical risk and adopting transferable lessons at pace from current conflicts. And I provide evidence of how we've used learning from an established high-performing rehabilitation system in the UK to build resilience in Ukraine while it's still at war. I also identify how our own UK military trauma system was transformed from inadequate to consistently exemplary within a decade, and how such a resilient system was developed through being willing to challenge dogmatic concepts and by driving change with a highly sophisticated governance system that exploits exquisite data on every seriously injured casualty. Because for effective and continuous quality improvement, I strongly believe that data is king. At the team level, I believe understanding the strengths and preferences of team members is essential, and this can be achieved through collective training using high validity simulation within a pressured environment. And for the predictably challenging environments that I've worked in, simulation needs to go beyond just the physical environment that tests team dynamics and individual psychomotor skills in order to test the ethical challenges that you will face, because this will reduce stress when faced with those ethical challenges, and it will speed decision making when time is critical. It also will help avoid moral injury, which was widespread within the civilian health system during COVID, because people were facing ethical choices that they had never previously had to consider. At the individual level, I share my experience of building the resilience of soldiers pre-exposure through a program of mental resilience training that starts in basic training. And I identify the post-exposure tools used effectively by the Army to limit the impact of traumatic and morally injurious events. And finally, at the societal level, I co-founded a charity called Citizen Aid, specifically to build public resilience to the rising trend of injury from deliberate attacks, including stabbings. And the charity's motto is "Be prepared, not scared." And we have award-winning materials for all ages from primary school to adult. And the story of why this was necessary and how it was achieved is a case study in building societal resilience. I've worked in both the civilian healthcare sector as a professor and consultant in emergency medicine, and in the military healthcare sector as a clinician and a strategic leader. And I would observe that the challenges are remarkably similar in both sectors, but the priorities can differ. Within the military healthcare sector, my attention's been fixed as the Surgeon General of the UK Armed Forces and the elected chair of the Committee of NATO Medical Chiefs in ensuring that we're prepared for large-scale combat operations, however improbable. Although with the Russian war against Ukraine and growing instability in the Middle East, this probability has never been higher in my 40-year career. My leadership in the NATO medical community has ensured our collective medical risks have been fully understood by our military and political leaders, and we have the support to address them. I've also brought the Alliance's civilian and military national healthcare leaders together to work collaboratively to address the complexity that dealing with large-scale casualties brings, be that the resources for large-scale medical evacuation or the regulatory barriers posed by interoperability of drugs and blood products. But the biggest challenge for the military healthcare sector is also the biggest challenge for the civilian healthcare sector. And that's the available workforce, because there's a global shortage of healthcare workers. COVID has left many exhausted and demoralised, with a high intent to quit the health professions. There are worrying rates of mental ill health. Pay, which was previously a hygiene factor, has become a decisive factor, and resilience of the workforce is now absolutely paramount. I believe that flexibility of employment across healthcare disciplines, favouring competencies rather than simply traditional labels, will be the key. And how we motivate young people to seek out a career in healthcare and to stick with it when the environment is tough is going to be critical. And these were messages that I gave to new graduate doctors this summer in a keynote address at Warwick University. I've learned a lot about personal resilience through a career in military medicine, and I would identify a handful of factors. First is your training. It's a truism that in a crisis you don't rise to the occasion, but you sink to your level of training. And I learnt this early in my career when I was at the receiving end of an IRI bomb in Belfast in 1991. They blew up the hospital where I was working. I was a junior doctor, just a young captain, yet the exams that I'd done made me the most qualified for that situation. So despite not being the senior rank, I took charge as the medical commander. So you can lead, I would observe, from anywhere in an organisation. I reflected a lot on that incident, and I could easily have developed post-traumatic stress, but I didn't. I instead experienced post-traumatic growth. I took the experience and turned it into 2 books and a course, which became the international standard for managing multiple casualties for both civilian and military environments. And I've used that approach to take learning from all my difficult experiences and turn them into educational products for others. Books, academic papers, clinical guidelines, new processes, novel curricula, and even the new charity, CitizenAid, with a free app for the public to empower them to respond effectively in a deliberate attack. And when CitizenAid was launched by the BBC in January 2017, it became the #1 trending app internationally within 48 hours. So training and post-traumatic growth have been personal resilience mechanisms for me, as has serial exposure to traumatic events. You don't know how you're going to respond to a crisis until you've been in one, but it sure does get easier when you have reference points from experience. I'd also say that sometimes acceptance is also necessary. When I did a tour as the helicopter doctor in Afghanistan in 2007, flying into the firefight to collect the seriously injured, my horizon was pretty short. I'd be thinking of the next mission, or at most the next 24 hours. If chips were on the menu at lunchtime, then I'd have chips. And if they were on the menu for dinner, then I'd have chips again, which is terrible for the waistband, but great for the soul. But I'd say that my most powerful resilience tool in the last 30 years has been to write contemporary war poetry, critical reflections of morally injurious events written in near real time. And I launched my book of poetry called Frontlines and Lifelines at the 2024 Edinburgh Fringe, performing at Craig Lockhart, which is the site of the World War I shell-shock hospital where our poet household names met as patients: Wilfred Owen, Siegfried Sassoon, Robert Graves. And if you want insight into resilience to the most unimaginable situations, you need only read that book. The royalties are to the Poppy Factory charity, of which I'm a trustee.